this is a topic that's quite close to my heart, really. I do the pre-transplant workup, but obviously the post-transplant setting is really important for the patients that are already experiencing problems. So I set up a women's health clinic, and really it's to share my experiences of this women's health clinic, but it also gives people information about complications that women face post-transplant. And obviously graft versus host disease is one of those in the allogeneic setting, and it's really important to sort of like just to highlight it and pick it up early and try and prevent any complications where possible. So that was really the focus of my presentation yesterday. Graft versus host disease, as we know, can affect any organ. Most of us focus on the skin, the liver, the gut, but it actually does affect quite significantly the vagina vulval area and obviously the penis. But it's really, the penis is obviously able to be seen, whereas the vagina is much more difficult. And this interest really came from a patient that came with a horrible discharge. And when we actually got her referred to gynecology, we could see that she was extremely inflamed and sort of just painful. So we identified that she had graft versus host disease and then needed to treat it. So it can be so multifactorial, it can be for many different reasons. So that's one of the difficulties with sexual health and graft versus host disease. So we don't ever really know what we're actually treating, but it's about trying to get a good diagnosis and getting the best treatment. So graft versus host disease in that setting is really difficult as well, because your topical steroids are probably not going to get high up into the vagina. It's quite good for the vulval area, but not necessarily for high in the vagina. So I think really it's talking to our patients and just making sure that they're aware that these complications can exist. And my women's health clinic really is aiming to highlight that. And it's just to sort of say to members of staff, just try not to be embarrassed about talking to patients about this topic, and actually just highlighting that it exists and that just come forward and speak with us, really. And it can be so many things. It doesn't just have to be the horrible discharge and the horrible blistering. It can actually just be dryness and atrophy and scleroderma-like changes or lichen planus-like changes.